What even is an SLP?
How do you become one?
What's expected of me after I graduate?
We're here to answer these questions and more, so be sure to like, comment, and subscribe, and stay tuned for another video from Lone Star Speechies.
So what is a speech language pathologist? The American Speech Language Hearing Association, or ASHA, defines SLPs as experts in communication. SLPs work with all types of ages, from babies to adults, and they treat many types of communication and swallowing problems.
This means we have a huge scope of practice, but of course there are some common misconceptions about what an SLP does.
I don't want to just play with kids in a therapy room.
While some therapies may look like playing, they're actually a framework that SLPs are trained to use that is safe and familiar for the child. This framework allows SLPs to gather data and administer treatment to those who need it. For a kid with an expressive language disorder, this may include things like farmhouse toys, where a child is working on labeling and expressing what the animals are doing on the farm to work on those skills. Whereas a kiddo who's atypically developing their pragmatic skills, which is how we use language, this may look more like a register or a kitchen playset, where the SLP and the child work on turn-taking skills, eye contact, as well as proximity to your conversation partner. The point of all of that is this framework may look just like playing, but it really is a tool to guide therapy.
And of course, if kids aren't your favorite population, SLPs also work with newborn, geriatrics, and anywhere in between. The whole lifespan is actually included in our work. We also have many different settings that we're able to work in, such as private practices,
Physicians' offices,
hospitals,
schools,
colleges and universities,
rehabilitation centers, and long-term or residential healthcare facilities.
SLPs can work with babies in a NICU or early intervention setting, all the way up to hospice care in skilled nursing facilities or even home health. In short, an SLP has the potential to see patients and clients from birth to any age.
Okay, but I still don't have an interest in lisps and other speech sound disorders.
No worries. As ASHA's definition states, SLPs work in communication and swallowing. This leads us to what's called the Big 9 areas. The 9 different areas in an SLP's scope of practice. These include:
first is articulation. This is what a lot of people usually think about when they think of what an SLP does. This includes things like rhoticism, which is difficulty saying the R sound, lisps, as well as other distorted speech sounds. And don't worry, we're planning a whole series discussing these types of disorders later on in the channel.
Fluency. Fluency is smooth, effortless speech. So the affected population here are people with disfluencies, more commonly known as people who stutter.
Voice and resonance. Voice therapy usually includes a team of clinicians and physicians to help those with atypical vocal qualities such as breathiness or hoarseness, as well as other vocal pathologies such as vocal nodules or inflammation of the vocal cords due to misuse of the voice.
Receptive and expressive language. Receptive language, the language that we receive, and expressive language, the language we express, are pretty self-explanatory. An SLP helps to increase and refine the patient's vocabulary and language use for either realm, increasing their ability to communicate with those around them. Language disorders occur when a person has trouble understanding others, receptive language, or sharing thoughts, ideas, and feelings, expressive language. Included in language, SLPs can also help improve literacy. Reading fluency, decoding messages, and writing abilities all fall under our scope of practice.
Hearing as it impacts speech and language. So SLPs also help kids with hearing loss and help assist their parents learning how to help their child get used to their assistive hearing devices, such as hearing aids or cochlear implants. An SLP will help this population, assuring that they have access to language and communication. An SLP can also conduct hearing screenings on new clients as well as other students to make sure they have access to everything they need to succeed.
Swallowing. Swallowing disorders or dysphagia can affect all age ranges, and it is an SLP's job to assess and work with a team of clinicians and physicians to determine the best course of action considering the modifications and swallowing strategies for these patients.
Cognitive aspects of communication. Things related to cognitive abilities affecting communication include things like executive functioning, attention, memory, and all of those can be affected by things such as anoxia, which is not getting enough oxygen to your brain, traumatic brain injury, or even some congenital disorders.
Social aspects of communication. Pragmatics, or the use of your language, affects our communication, and when a person uses language in ways that hinder their communication, That's where the SLP comes in. Things like understanding figurative language, inferences, and less obvious things like topic maintenance and eye contact or proximity are all social aspects of communication.
Communication modalities, or AAC. Augmentative and alternative communication is a large realm of speech-language pathology that usually includes our more severe populations. AAC is anything other than typical spoken language used in a communicative way. So this can include things like sign systems such as ASL, communication boards, or even more high-tech devices like tablets with different programs that help people communicate.
Well, that all sounds a lot more interesting than I thought, but how do I even become an SLP?
So there are a lot of paths that lead to becoming an SLP, but in general, it's really what you want to make it, as long as you follow a few requirements. For your undergraduate degree, a lot of schools do offer an undergraduate degree in either communication sciences and disorders or speech-language pathology and audiology. Both of these degrees are where you'll start learning the ins and outs of speech-language pathology as a field. This is where you'll get your first taste of the International Phonetic Alphabet, your introduction to audiology, as well as learning about the speech anatomy itself. You'll also conduct clinical observations during your undergraduate degree, which will help prepare you to become a speech-language pathology assistant, or SLPA.
This isn't the first step that everyone takes, though. In many programs, there are leveling groups, either as a post-baccalaureate or as part of the graduate program. This is for students who either had undergraduate degrees in other fields or had graduated from their undergrads long enough ago for the program to require them to take these classes again. This way, the students will be fit to begin their graduate coursework in the second semester. The coursework may be tough, but it's going to be a benefit in the end because all of this information will be fresh on your mind whenever you start grad school.
Once you get your undergraduate degree in communication sciences and disorders, there are a few paths you can take from there. The first is to not go on to grad school. You can become a speech-language pathologist assistant, SLPA, SLPA, they're all the same thing, and the requirements for this position differ a little bit just depending on what state you're in. In general, a SLPA will help a speech-language pathologist who supervises over them with things like administering treatment. So while a SLPA cannot do everything that a certified SLP can, they do help their supervising SLP in a lot of aspects of their job.
The next option would be your master's in CSD. Graduate school may seem scary and unattainable, but don't worry, it's not really as scary as it seems. We'll talk more about how to get into grad school in a later video. A master's in communication sciences and disorders usually includes more in-depth study of various topics such as aphasiology, motor speech disorders, swallowing disorders, speech sound disorders, and research methods, as well as having a clinical practicum. Most programs have 3 semesters of a part-time internship and 1 semester of a full-time internship. All of this prepares you for graduation and passing your licensing exams. After you graduate with your master's degree, you must complete a clinical fellowship year, or a CFY, where you're practicing under the supervision of a licensed SLP for 9 to 12 months before you can become licensed yourself and practice independently.
The third track you can take after your undergraduate degree is audiology. The doctorate of audiology prepares you to be an audiologist in the field. An audiologist is a doctor who conducts audiological screenings, which are full-scale hearing tests. They help prescribe hearing aids and other assistive hearing devices, and they make sure that these devices work well and help their patients get the access to the communication that they need. It is possible to be dual certified as an audiologist and a speech-language pathologist, but you do have to go through both programs to be able to be dual certified.
You don't have to have a doctoral degree to practice as an SLP, but there are options. A few of these options are research focus, a PhD for a clinician who wants to study and research specific topics. These clinicians have a mind for science and want to find and provide new information to the field.
The clinical focus. So the speech-language pathology doctorate is a clinical doctorate that prepares a clinician to become a master clinician. Doctors in SLP will help assist as well as support research. The program also prepares these clinicians to be leaders either in education or administrative positions.
Both degrees are not for the faint of heart, but they can help an SLP advance their career or help them to find their specialty in the giant field of SLP.
So now that you know more about what an SLP is and what they do, we asked various professionals to fill out a short Google survey asking about their experience through academia and where they work now.
Out of the 15 responses, 6 are licensed in Texas, 3 in California, 2 in New Jersey, and the remaining 4 were licensed in various states such as Michigan, Oklahoma, Nebraska, Florida, New Mexico, and Maryland. Out of these 15 responses, 3 achieved doctoral degrees in the field.
13 of our responders have their certificates of clinical competency, or as we usually call them, their Cs. This just means that they are certified through ASHA's requirements to be a practicing speech-language pathologist. One of our responders is also certified by the McNeil Dysphagia Therapy Program and trained to administer FEES, which is fiber optic endoscopic evaluation of swallowing. This is a procedure to evaluate the swallowing mechanisms of a patient. Another one of our responders is board certified by the Academy of Communication Disorders and Sciences and works in a neuro outpatient facility.
As you can see, SLPs are in all types of settings, so don't worry if you don't prefer a specific site. You can definitely find a different one.
In the description below, we have linked to the Google form that we used to ask these professionals about their experience, and we'd love for you to fill it out too. Go ahead and fill out that form and possibly be mentioned in a future video.
So now we know about what exactly an SLP does, how to become one, and for those of you starting to think about undergraduate or grad school, be sure to hit the bell so you don't miss out on future notifications about next week's video where we'll talk about all of our tips and tricks for life as a college student.
As always, like, comment, and subscribe. Thanks for watching, and we'll see y'all next week from the Lone Star Speechies.
These bloopers are gonna be solid. Okay. Okay, 3, 2, 1.
So, oh god. Not a new take. I just need to read this.
Take 2.
Dancing? I would never dance. Speechies. Ma.
Quality. The notes, honey. Okay.
Bloopers!
Bunch of big words. It's fine. I almost have a graduate degree. I can read big words. Reflective and expressive language.
I thought you said reflective.
Did I say reflective?
It might just be FaceTime, in all honesty.
Take 2. Here we go. We're just gonna cut that right out. Okay. Yoo-hoo, big summer blowout. Yoo-hoo.
I had sour cream and onion chips.
Oh. So until you said chips, I was just I was thinking like a bowl of sour cream and you put onions in it. And like, you just...
Do a dollop of daisy.
Moving on. Hey.
Improv.
It's just not happening, okay? What would you like today? Language? Okay, cut the tomato. I'm exhausted. Got so many cheeses. This is not what I ordered. Whoa. Well, that all sounds a lot more interesting than I dadgum thought. Okay.
We're from Texas, it don't matter.
You ever thought what it'd be like to be a turkey? I had a pet turkey once. Take 75. Gonna cut. Send help. Cut. Period. Is it my turn? Imagination. Okay, you can be the editing queen today, okay? So don't worry if you don't like a Pacific site. You can go to the Atlantic. We're still recording. That's lit. You have to. All right, y'all. Let's read all the sources. https:// That's great. On the magic school bus.
I can see the ring light in your glasses.
I need this higher. In the prairie of SLP.
Okay.
Okay, thank God that's done. Am I still recording? I checked again, it's recording.